Good afternoon, everyone. I'm stepping into Jim Jarvis's shoes today. He's got having some well deserved time off. I'll share with you the current numbers. As of this morning, we have 79 total inpatients in our system. 13 are at AR Gould Hospital, 34 at Eastern Maine Medical Center, 5 at Inland Hospital, 4 at Maine Coast Hospital, 2 at Mayo Hospital, 16 are at Mercy Hospital, and 5 are in Sebasticook Valley Hospital. We also have 25 COVID-19 home care and hospice patients. The 2-week positivity rate is 19.08%, and the 1-week positivity rate is 21.49%. That's the first time that the positivity rate at Northern Light Health has exceeded 20%. The continued rise in positivity rates indicates that COVID-19 is more prevalent than ever in our communities and speaks to the need to, you've heard this before, get vaccinated and boosted, wear a mask in public, stay home if you're sick, and continue all the other healthy behaviors that really can make a difference. We also have available our most recent COVID-19 hospitalization graphic. The numbers continue to show that those who are vaccinated have lower cases of hospitalizations and severe illness. And as we've noted before, this graphic represents a snapshot in time, and the data is constantly changing. The graphic, which included data compiled yesterday morning, will be shared in the chat. Hospital capacity. I shared earlier that there are currently 79 COVID-19 positive hospitals at Northern Light Health System hospitals. After falling slightly during the past month, our COVID-19 inpatient numbers are creeping back up to what we saw in early December. Hospital capacity throughout the state continues to be strained. We do anticipate that this will continue as we see additional cases from holiday travel and celebrations. Omicron update. As the Maine CDC shared earlier this week, the Omicron variant is not yet the dominant strain in Maine, but it does comprise more than 30% of cases at this time, and its prevalence will increase quickly. While it's difficult to provide an exact timeline, in other states and countries, Omicron became the dominant strain very quickly, and we've no reason to suppose that Maine will be any different. I'd like to turn it over to Matt now for an update on COVID-19 vaccination and treatment. Matt?
Matt, stand by. You need to unmute yourself.
Oh, sorry about that. So good afternoon. I'll be updating all of you on COVID-19 booster vaccines and other vaccinations, as well as COVID-19 treatment options. On Monday, the FDA amended the emergency use authorization for Pfizer vaccine. I wanted to share how we've responded to these changes and what our patients and their families can expect. The FDA has expanded the use of single booster doses for individuals between the ages of 12 and 15, and parents can now sign children of this age group up for boosters on our website at locations across Maine. Parents may also wish to discuss the booster with their child's pediatrician and get a booster shot at the pediatrician's office, particularly if a visit is already scheduled. The FDA has also shortened the time window between completion of primary vaccination series with Pfizer vaccine and the booster dose from 6 months to 5 months. Our website now reflects this change and will allow eligible individuals who have had their vaccination series more than 5 months ago to sign up for a booster vaccine. And finally, the FDA allows for a third primary series dose for certain immune-compromised children between the ages of 5 and 11. I encourage anyone with a child that meets those criteria to have a conversation with their pediatrician to consider getting a third shot as soon as possible. It's especially important for this vulnerable population. While pediatric hospitalizations have not increased in our state at this time, other areas of the country are seeing many more pediatric inpatients. Vaccination and boosters are and continue to be the best way to prevent this from happening. People living in southern Maine who need a booster or a primary vaccine series are encouraged to drop by our Maine Mall vaccination site at the former Pier 1 location. This clinic was highly successful before we took a break for the holidays, and we're pleased to open it back up again. No appointment is necessary for this clinic, and vaccines will be available between 1 and 7 p.m. and on Saturday from 9 to 2 p.m. We plan to schedule future dates and we'll announce these as soon as they are known. For those that do not live in Southern Maine, I would encourage you to visit our website and schedule an appointment for a vaccine that's closer to home. In terms of COVID-19 treatment options, I can provide an update. The FDA has issued emergency use authorizations for Pfizer's COVID-19 antiviral medication Paxlovid and Merck's medication called Molnupiravir. We've received several questions about when these medications will be available in Maine. Northern Light Health has not yet received any doses, though we understand that some retail pharmacies in Maine, including Walmart and Hannaford's, have received them and may have both of those available. We await additional details from the state on exactly which stores will have these available. And we know that supplies are going to be extremely limited. And we encourage anyone who has questions to follow up with their provider, as a prescription will be required to receive those medications. Finally, as Delta remains the primary variant circulating in Maine, at least for now, we continue to treat patients who qualify with the 3 available monoclonal antibody treatments. This will change as Omicron becomes the dominant strain, as only one of the monoclonal antibody treatments has shown to be effective against this new variant. People who have avoided vaccination, believing that they can easily access pills or monoclonal antibody treatments if they get sick, may find that these options are not readily available to them. These treatments add additional important tools to our fight against COVID-19, but they do not replace the importance of prevention with vaccination. The single most important thing that you can do to protect yourself and your community from serious harm resulting from COVID-19 is to get vaccinated. And with that, we'll take questions.
Okay, thank you very much, Matt and Paul and Dr. Ducker. First up for questions is Brittany McCatton from WABI. And Brittany, you should be able to unmute yourself and ask your questions. Brittany? Let's try that again. Brittany, can you unmute yourself?
Yes. Okay. Can you hear me?
Yep.
Okay. I was not able to unmute myself there for a little while. Sorry about that. My first question is probably best to Dr. Ducker. I'm curious about the accuracy of the at-home tests with Omicron. Have you seen that perhaps the at-home test might be less accurate in having a positive result when somebody does have Omicron or the coronavirus in general? And we're also hearing there's word, out there about how a throat swab might be able to generate more accurate results with these at-home tests. So can you please talk about the effectiveness of the at-home test and if a throat swab might be good to do?
Dr. Ducker, you need to unmute yourself.
So I'll probably need Matt's help with this, and I'll expect him to jump in from time to time. But the home tests are antigen tests. All tests have false positive and false negative rates. They are accurate and reliable. And obviously people should follow those instructions and act on the results. There are some complex data analysis that needs to be done based on the incidence of the disease in the community, but we now have sufficient disease active in the community that kind of neutralizes any concerns about false negative rates. So they are reliable, and they should be used with confidence. In terms of your questions about the sightings of the swabs, there is debate around that issue. But I would encourage any member of the public to follow the instructions that they have on the antigen packet that they have, and not stray from that, because they've been the test that they have that they're using at home has been designed for the instructions that accompany the test. And over time, if it becomes clear that we should be doing routine throat swabbing with antigen tests, those tests, the instructions for the tests will change accordingly. But for now, it's very clear that you should just follow the instructions on those home tests. Matt?
Yeah, I'll echo that. And then also I'll say, as with any tool that is at our disposal, you need to use the right tool for the right job. And rapid tests at home definitely have an important place in managing the pandemic. And for those that are symptomatic, that may have upper respiratory symptoms, that may lend themselves to think that they might have COVID-19, the rapid tests tend to be more accurate in those groups of symptomatic individuals. For those that are looking at testing post-travel or before travel, or that may have been exposed to an individual that had COVID-19, the longer turnaround rapid tests, or not rapid tests, but PCR molecular tests tend to be more accurate in those asymptomatic categories of patients. So if you're weighing whether or not to use a rapid test versus a molecular test, whether or not you're symptomatic can play an important role in which test selection you make. The rapid tests that test for the antigen of COVID-19 are much more accurate in the setting of those that present with symptoms. And now with the recent changes in CDC guidance as well about quarantining and isolation and the addition of the option to test after 5 days, the rapid tests are quite effective at detecting whether or not there's still infectious virus present in the nose of the individuals that test themselves. So that would be a good option for those individuals, that home rapid test, to test at the end of that window as well, to make a decision about whether or not they can return to the public with masking as indicated in the CDC guidance.
Thank you very much to the both of you. My second question, Matt, will stay right on you. And you talked about the Maine Mall, the Southern Maine mass vaccination clinic. I feel like we ask this every week, so I'm sorry, but is there any more talk about potentially opening a mass vaccination clinic in the Eastern Maine area, more up here? In the past, Dr. Jarvis has mentioned that staffing is one of the issues. I don't know if there's any more discussions, because I know a lot of people around here still struggle to find an appointment.
Yeah, so in the decision of whether or not to provide mass vaccination, while staffing is always a concern, there continues to be a variety of outlets in the Eastern Maine, including the Bangor region, to get booster vaccines. We are reopening the Union Street Booster Vaccination Clinic, which was very successful as well, which will be starting up next week. And we've already posted for appointments to be scheduled online through our website as well. In addition to that, our Northern Light Pharmacy locations are also offering a wide array of booster appointment availability. And we monitor that very closely to make sure that we're keeping up with demand. So I think looking in a variety of locations for booster appointments can sometimes be a challenge for the public, but I would encourage you to visit our website and look for booster availability, as we do have available appointments for those seeking boosters in the Eastern Maine and Bangor area. So we will continue to meet the demands of the community where they exist. And we want to make sure that if there are those that are looking for booster doses, that we're providing those to them so that we can get as many people protected as possible.
Okay, thank you for your questions. Brittany, we're going to move now to, I believe TV7 said they're all set, so I'm going to go right to News Center Maine with Chris Costa. Chris, if you're ready, you can ask your questions.
I am. Thank you so much, Chris. I appreciate it. My first question, I believe, is going to be for either Dr. Ducker or Dr. Marston. If you guys both want to chime in on this, I'd certainly be happy to hear your thoughts. There has been some talk at the federal level about adding a negative test component to the updated federal CDC guidelines around quarantine and isolation. And I'm just wondering your opinion on this issue. Is this something that you feel should be done? Does this kind of eliminate that potential issue of following the honor system for people to come back, after a quarantine or an isolation? That was a concern that had been raised by many parents and school nurses. A parent might say, "Oh yeah, my kid's fine, no symptoms," but there's really no check and balance on that.
Yeah,
okay, Matt, you want to take it, Matt?
Sure, I can speak to that. So we do believe that there is value in testing at the end of the 5-day period that's referenced in the isolation and quarantine guidelines by the CDC. Dr. Fauci has spoken about this as well and sees value in potentially adding that testing option into it. It is possible that individuals can test positive after 5 days and still potentially be infectious. It is very important with these guideline changes that people realize that just because you could return into the public after the 5 days, the need to mask is paramount. And that really prevents the spread of that virus. The science behind these changes really indicates that, in particular with the Omicron variant, individuals are most infectious in the 2 days before they develop symptoms and the 3 days after, and that the virus is cleared fairly rapidly from the body, and that individuals are far less infectious from day 5 moving forward. But those tests can provide an important safety net for individuals to feel more confident that they are not as infectious with an undetectable virus on a rapid test done at day 5. So while we're eagerly watching these changes and we're adapting as we see them come forward at Northern Light Health, we certainly in the medical community see value in testing and making sure that we're utilizing tests where they are appropriate.
Okay, Dr. Ducker, was there anything you had to add?
No, I think Matt covered that very well.
My second question has to do with masks, and again, it would be for either one of you. There has been a lot of discussion about kind of cloth masks maybe not being as protective as they once thought to be, especially with the Delta and Omicron variants. So I kind of have a two-part question for you here. The first part has to do with masks for kids. So many kids are wearing those cloth masks at school. And I don't know if you guys are aware or if there's an option that we can tell parents about that might meet kind of those the guidelines that are being kind of put forward as what would be considered a quote unquote safer mask, you know, the blue surgical mask or a KN95. Are there any options like that for kids? That's part one. Part two, there are many cloth masks that allow you to put in a multi-layer filter, and people are wondering if that might be a suitable substitute to just a cloth mask without a filter.
Who wants, Dr. Ducker, do you want to take that one, or is that something, Matt? I think it'd be more up your alley, Dr. Ducker.
Yeah, I'm happy to start, and I'm sure Matt will have some additional comments to make too. I mean, I think that what I'd say about masks is that it's if you like, it's a graded efficiency. No mask is worse than a cloth mask, which is worse than a surgical mask, and the latest published research appears to confirm that. We've always thought that's the case, and it appears to confirm that. So, you know, I'm not against cloth masks if that's the only option, but if if the individual has an option to use a surgical mask, placing it over the cloth mask is more effective at reducing spread than the cloth mask alone. And masks, as you know, lose their efficiency once they become wet with moisture from the breath, and that tends to happen quicker with the cloth masks. So they tend to lose their effectiveness efficiency earlier in the day, and as the day goes on. So the answer to your question is, in an ideal world, surgical mask for everyone. Over the cloth mask is even better than just anything else. But if cloth masks are all that the individual has, that's still way better than no masking at all. Matt?
Yeah, the only thing I'll add with Omicron, which is much more adept than even the Delta variant in spreading from person to person, as we've found, is that there's some information out there about whether individuals should consider a higher level mask in protecting themselves and others from COVID-19. So debate's still out there on that one a little bit, but certainly, as Dr. Ducker mentioned, there are grades of protection from masks where a cloth mask is better than wearing no mask at all. A surgical mask is better than wearing a cloth mask due to the tightness of fit and the testing that goes into the layering behind those masks from reputable sources. And then you have others like N95s and KN95 masks that provide an even higher level of protection due to the tight fit and the multiple layers on top of what's typically provided in a surgical mask. So certainly not all masks are created equal, but I think the important thing that people adhere to here is that these face coverings, be it a mask or a cloth face covering, one of their primary effects is to prevent the spread from one individual to another through droplets and the transmission associated with that. So by covering your face and your nose included, which is an important piece, you are thereby lessening the chance that those respiratory droplets will travel from you unknowingly, because remember, you could be asymptomatic for 2 days and still be infectious before you develop symptoms, from one individual to another. So that's really why the masks are so critical, is making sure that that asymptomatic spread in particular is cut down to a minimum, because respiratory droplets can't travel as far from one person to another. So while I think in a perfect world, if everyone was wearing an N95 mask, that would provide the greatest level of protection, it's also really not feasible for that to happen, both due to supply and resources. And then it also may not be necessary in all situations and level of exposure and the risk that people might have from typical day-to-day activities.
And so specifically to your question, Chris, about kids, I mean, the advice is much the same. If they have a cloth mask and that's all they have, that's great. If they have access to a surgical mask, that's even better. The combination is even better still. And that's kind of our advice, in addition to hand washing, social distancing, and all the other measures that we know reduce infectious spread.
Okay, thank you very much for your questions, Chris. We're going to move on to Joe Lawler from Portland Press Herald. Joe, let us know who you want to address your question to, and please fire away.
Okay, thanks. Actually, I'm not really sure who would address this, so I'll just throw the question out, and then you can pick who to answer. So one thing I'm wondering about is with the arrival of Omicron, New York State and the United Kingdom have decided to differentiate hospitalized patients, those hospitalized with COVID, versus those who tested positive for COVID while being at the hospital for another reason, versus patients who are hospitalized because they have COVID. Do you think this is potentially a good idea once Omicron becomes the most dominant strain here?
I think we can definitely look at applications for that. We will certainly do so. What I will say for certain is right now, those that are in our hospitals that have tested positive for COVID-19, the vast majority of them are there because of COVID-19, and they are ill from COVID-19 related illness. The number of individuals that just happen to test positive that are in the hospital for other reasons continues to be an incredibly small fraction of what we see for our COVID-19 inpatients at this time.
Go ahead, Joe. Yep.
Okay, sorry. And my second question is just, I was just wondering if there's any updates on the federal assistance that the hospitals have been getting, either the National Guard and or the Biden administration's team for EMTs. Thanks.
Is that a Paul question?
What was the question?
Are we getting any other supplemental help from National Guard or feds?
So we've been working with the state on those requests, and we've really provided a number of points of data, so the state understands what our needs might be, as well as FEMA if additional resources become available. So we're continuing to look at that, but at this point, we're not expecting any additional staff beyond the FEMA and National Guard members who are on site.
Okay, thank you for your questions, Joe. Next up, we're going to go to Patty White from Maine Public. Patty, again, let us know who you'd like to direct your question to, and you should be all set to go.
Thank you. I think this question is for Dr. Ducker. We know that hospitals are facing a lot of strain with capacity, and you guys have in the past have spoken about how there are long wait times to get patients into the right place or the right level of care. What's the situation now? Has that gotten any better?
I don't have any specific data for the numbers this week, and I can certainly get back to you with that. But we have done a little better as the numbers went down. The challenge for us is going to be, if these numbers continue to increase, we may end up back in the same situation we were in 2 or 3 weeks and in the months leading up to it. Obviously the rate limiting step has been being able to discharge a patient to the level of care that they need, which may not be to their home, and the facilities that we use have their own struggles with staffing, because it's not just patients, it's not just our patients getting affected with COVID, it's staff as well, being able to staff adequately. And my understanding is that there may be some help being diverted from the feds to assist those facilities to stay open.
So, I mean, the federal resources so far, would you say that they have helped with that, or is it the fact that the wait times have been reduced a little bit? It's more a function of just fewer people in the hospital.
It's a function of the lower numbers that we're seeing, and I'd have to get back to you with exactly what the feds are going to do in terms of supporting these facilities. But my understanding is that that's being looked at.
Okay, thank you for your questions, Pat. Are you all set?
Yes, thanks.
Okay, next up is David Marino from Bangor Daily News.
Thanks, Chris. This is for Paul. Would you be able to provide any specific stats on how many staff members at Northern Light hospitals are out of, can't work due to contracting COVID themselves?
Sure.
If you don't have specific numbers, maybe a ballpark percentage.
Sure, I've actually got numbers. So we have 493 employees who are out of work today, as of for either active illness that have tested positive, or for quarantining and testing, waiting for results. That number is a significant increase, is more than double what it was a month ago. So it's a significant sign, and those employees who are testing positive, the vast majority of those are employees who've identified community exposures through community activities, holiday events, family events, social gatherings, et cetera, oftentimes unmasking. And so masking continues, as well as being vaccinated and fully boosted, really is a critical piece. And I know as we walk up and down the street and in stores and other areas, masking is a critical component to our safety, and and outside work behaviors is really a significant safety issue for our staff, as well as for our community at large.
I appreciate your answering that. Is that having an effect on operations? And my second question was, given Omicron, if a booster mandate was being considered by Northern Light in light of the new variant.
Sure, and so certainly having 4% of our workforce out at any given time is a negative impact to our operations. We're hoping that number doesn't continue to increase. That's just slightly above the highest level that we had a year ago in terms of staff numbers of staff out of work due to COVID. And so this is our all-time high number at this point, and we hope that it goes down from here. Although we're prepared to see it continue to increase as we see post-holiday illnesses from and exposures from staff. To answer your question regarding booster shots, we don't have any plan to mandate boosters with our staff. We certainly are strongly encouraging our staff to get the booster if they're eligible to get it. We have a number of staff who were vaccinated in the final weeks prior to the state's mandate, so they're not yet eligible to be boosted. But those employees who are eligible, we encourage that. Right now, we've got about 4,000 employees who've been boosted. We have about 3,000 additional employees who have not been boosted, but who are eligible. And then we have another group who are fully vaccinated by the state's definition and waiting for their eligibility to become boosted.
Thank you for your questions, David. And last but not least on our list is Talia Clark from WMTW. Talia, you should be able to ask your questions now.
Okay, thank you. This question is for Paul. So are hospital employees following the new quarantine and isolation requirements that the CDC is giving to the general public, or are they still sticking to that 7-day quarantine isolation for hospital workers?
Sure. So hospital workers, healthcare workers in general have had different standards. So what you see in the media regarding 5 days for the CDC quarantine period for healthcare workers, that's 7 days. And so we've been focused on navigating the changes, and we are working through policy changes today, and we anticipate changes going into effect later today to reflect some of those changes implemented by the CDC. But it's important to note that healthcare workers, because of the nature of the work, have tighter quarantine requirements under the CDC guidance. So it's not the 5-day period, it's going from 10 to 7 in some circumstances. But in other circumstances, home exposures and others, the time out of work is actually increased under the CDC's new guidance. And so we're navigating all of these nuances to ensure that we're fully compliant, and we expect to have those policies out later today.
Thank you, Paul. And I have one more question. I believe this is for Dr. Ducker. So of the 79 people hospitalized at Northern Light Health Hospitals, how many of those people are children?
Dr. Ducker, you need to unmute yourself.
Yeah, sorry about that. Are we able to display the graphic? Does it not give an age-related breakdown?
We don't have, oh, we do actually. The infographic does have a breakdown of COVID hospitalizations.
By
there
by age as well, I believe.
Yeah. So Talia, that information based on hospitalizations, if you look at the infographic that we put in the chat, that has it listed by age.
I don't have a copy in front of me, so I can't tell you the exact number. I'm sorry.
That's okay, Talia. It's in the infographic. So if you have any other follow-ups, but you have the information there. Talia, do you have any other questions, or will that suffice?
That's all I have. Thank you for that. Thank you for your time, everyone.
Great. Well, thank you very much to members of the media for attending this press briefing. I think that wraps it up as we've made it through the list. We thank you again for your interest and wish you all a good day. And Paul or Dr. Clark or Matt, if you have Dr. Clark, Dr. Ducker, if you have any final things, I'll let you have you say your goodbye, and then we can move on.
Well, I echo that. Thank you for attending. Hope we were able to provide answers that or what you're looking for. You know, I said it at the beginning, I'll say it again. Omicron will become the dominant strain. We know it's highly infectious, so all the public health measures that we've been very clear about from the beginning of this pandemic, staying at home when you're sick, hand washing, mask wearing, social distancing, it's never been more relevant to our daily lives. We really appreciate all the help that you've done over the pandemic in ensuring that the public hear that message. So we appreciate it. Thank you.
Thank you.
Thank you, everybody.